This message is brought to you by Kenyan Health Relief. Our team has decided to focus our research on the developing country of Kenya. The country of Kenya is the world's 27th most populous country and is located in Eastern Africa. It has a population of about 53 million residents and is the 47th largest country in terms of landmass. Kibera is one of the slums in Kenya's capital city of Nairobi. It has about 250,000 people living in it. There are many developmental challenges in the country, of which we chose to mainly focus on the health in Kenya and developing a sustainable healthcare system. The name of our organization is Kenyan Health Relief, and the mission is to work on implementing sustainable and effective healthcare by 2030 in Kenya. This is aligned with the United Nations Sustainable Developmental Goals, and our vision is to provide healthcare to the majority, if not all, of the population and citizens within the country. Our first developmental goal is to create universal healthcare. By creating a universal healthcare program in Kenya, we are able to provide all people with access to health services without the risk of financial burden for those seeking healthcare. Kenya has already launched a pilot universal healthcare system in 4 countries, which started on December of 2018. Countries like Makueni have already seen a significant rise in the number of enrollments in local healthcare insurance programs to date, rising from only 8.8% to 91% in 5 years. Universal healthcare programs are proven to have a direct impact on a population's health and welfare. Although poor countries like Cuba have proven that universal healthcare improves the quality of life of all its residents, regardless of their financial problems, it also ensures children can go to school and prevents people from going into poverty due to high healthcare costs. Our second developmental goal pertains to the epidemic of HIV and tuberculosis in Kenya. In a country where over 1.6 million people are living with HIV and AIDS, and another 150,000 people are living with tuberculosis, solving the crisis is an immediate concern. In order to combat this epidemic, Kenyan Health Relief hopes to set up centers around the country where citizens can be treated and also educated free of charge. One problem we face in this goal is a lack of awareness. In Africa, those infected with HIV or tuberculosis face a stigma from the general public. This stigma is based on lack of education surrounding the diseases. This leads many people to avoid seeking treatment. To mitigate this risk, we will educate citizens about HIV and tuberculosis in our clinics in order to destigmatize those infected and normalize the process of seeking treatment. We will measure our success in this goal based on the rate of new infections of both HIV and TB, and we will hopefully see a decline in both rates within the next 5 years by installing at least 1 new facility per year. Our third and final developmental goal pertains to the sanitation in the country of Kenya. With a population of over 50 million people, it is shocking when looking at the percentage of individuals who do not have access to proper living conditions and sanitation. According to the World Health Organization, there are over 20,000 deaths a year that can be attributed to both ambient and household air pollution as a result of biomass and kerosene stoves, or the burning of things such as rubber and various wastes. In addition to this, according to Water.org, a global nonprofit organization, approximately 41% of Kenyan population does not have access to safe drinking water, and 35 million people do not have access to improved sanitation. And in order to combat these issues, Kenyan Health Relief will strive towards providing safe and clean drinking water for as many people as possible within the country. We will also look towards researching and raising awareness concerning the reduction of biomass and kerosene stoves to reduce air pollution within the next 5 years and the following years to come.